Participants, we are going to resume our session as indicated on the program. We are going to invite Mrs. Rosemary, Madame Rosemary, for her presentation. Madame Rosemary, you have the floor for your presentation.
Honorable Oleri Simplice Zingas, Chairperson of the Committee on Health of the Pan-African Parliament, Honorable members of the Pan-African Parliament, the representative for African Union, Mr. Sabelo, my colleague, Dr. Catherine Sozi, our regional representative here in ESA, colleagues from other agencies, ladies and gentlemen. First of all, let me thank you, Honorable Chair of the Health Committee, and the members of the committee as well as PAP in general, for giving us yet again this opportunity. For me, this is the third time I with honorable members of parliament on the issue of HIV. And I've been asked to speak after Mr. Sabelo, who we work closely with the African Union on the issue of where Africa is as far as what Africa has committed to. And I think there is no better audience to interact with on what our own continent, on what the African continent has committed to. I've been asked to speak about if Africa has made progress, but I think my very easy because His Excellency, the former President of South Africa, my colleague, Dr. Sozi, this morning, all spoke about what we have achieved. But I want to begin by quoting our executive director. I mean, for obvious reasons, he's my boss, but also he's a very passionate son of Africa who wants to see the road to ending AIDS really perfected and ending AIDS achieved. 2 years ago, and this was during a heads of states meeting in Malabo, he said, and this is Mr. Sidibe, and I quote him, "Africa is moving from despair to hope, and if the current momentum is sustained, HIV/AIDS could as well be confined to the archives. Countries have achieved real progress on treatment and reduction of new infections, especially among children." And end of quote. I hope I can manage to operate this, because this is my weakest area of operation. Now, when we talk of progress in Africa to date, what are we talking about? And I think I won't go into too many figures, but I will just quote a few, because some of these were talked about in the morning, but I think it does no harm in reminding ourselves. 12 million of the 18 million people at least are on treatment therapy on this continent. New HIV infections have declined, in some countries by 50%. But at that time overall, in 2015, we had the decline at 33%. This morning when President Motlanthe was addressing us, he reminded us that this decline really needs to get steeper. And I think this is where this forum comes in. The number of AIDS-related deaths fell by half from 2005, and 60% decline in infections among children in 21 global plan countries were registered. I think these are stories. Africa's financial contribution to the AIDS response increased by 140%. I think we are very familiar with situations where you find or where you found that countries were almost 100% depending on HIV treatment and other services on other countries, the OECD countries. But today, you have countries committing to the AIDS response, and I think this region itself is a very, very good example, where you find that countries like Botswana are doing most of they are paying up their bills on HIV AIDS-related services. Countries like Namibia increasing. Countries like Zimbabwe bringing for the first time innovative ideas such as an AIDS levy. And I know some countries have actually come to Zimbabwe to learn this AIDS levy. And I'm glad that we have an honorable MP from Zimbabwe. I hope you can share later what is happening there, which is such a good story. So we are really making progress. But even when we are making progress in those areas, I think I won't go into this. Dr. Sozi this morning really highlighted where we really need to put our efforts on our children getting pediatric treatment, on making sure that we get tested, and making sure that services really get to the people and leave nobody behind. If I just look at East and Southern Africa, and you look at the numbers of the new infections, I think some of them today are quite unacceptable. By 2015, there were 996,000 new infections, especially among young people. And when you look at West and Central Africa, there were 416,000 new infections. And when you compare this with the rest of the world, in Europe, in Western Europe, there was only 91,000 infections. When you look at the size of Western Europe and the size of the African continent and the populations, I think this is not acceptable. So really, some of these are the figures where we are today and the kind of what spells the task at hand. I won't go into many statistics, because the papers you have in front of you, the Africa Catalytic Framework, really not only spells out those figures, but also goes ahead to say what kind of task we have at hand. Yes, we are achieving success, but we can build on this, and as former speakers said, we can end AIDS in Africa. The catalytic framework that we have with us here has shown what the vision of Africa is, which is an Africa free of AIDS. This has been spelled out in the 2016 declaration. It has been spelled out in the SDGs 2015, of which Africa is part of, and it has been spelled out in the Africa Agenda 2063. So the frameworks are there, the commitments are there. I think what we need is really to move on this goal. The milestones and targets are very, very clear. If you look at that small publication that the AU has circulated, it's showing the targets. And I think these are the targets that members of parliament can call the head of National AIDS Committee, they can call the Minister of Health, they can call the prime ministers in their governments and ask where are we on these targets. And I think this is where efforts from civil society, efforts of private sector can all be galvanized towards, so that these targets can be achieved by every country. One of the milestones that is in the catalytic framework is to reduce AIDS-related deaths to fewer than 375,000 by 2020, and bring this down to 150,000 by 2030. You realize that 2030 is close by, it's just around the corner. So what can we do? And I think in the other presenters, there are initiatives that are meant to support us to move towards this. Our health systems up to this job. Our resources up to this kind of approach. So these are some of the things that we really need to look at and ask. Community health workers, are they engaged seriously? Other services, NGOs. I was once a Secretary General of the Red Cross. They have so many volunteers. Are we engaging these? So we need to look at all the tools that we have at hand. And I think there is no better forum than this, which is a forum that brings together people who are actually in the center of where it's happening. The people who are at the center of, I think this is really why we have this conversation, and I'm so glad that Pan-African Parliament decided to host this. Another milestone is to achieve treatment coverage of 90%, 90, what we call 90-90, meaning that if we have our population, at least 90 of it, having tested and knowing their status, those who are sick, 90% of them are supposed to go on to treatment. And then those 90% who are on treatment should be responding positively. I think the scientific term is achieving viral suppression. I don't want to delve into that lest I'm asked what exactly the details are. But what it simply means is that everybody should know their status almost, and those who know their status and they need treatment get treated, and they feel better. That is supposed to be achieved by 2020. Africa has put their stakes so high in the catalytic framework that they've even put up the numbers to 95 by 2030. So this is almost 100%, which is really the definition of leaving nobody behind. But the question is, how can we quicken the pace? Oh, good. I didn't touch this, but it's moving. The question is, how do we move this pace? How do we quicken this pace? Number one is leadership. And I think that cannot be overemphasized. Political leadership. If you look at the continent, the countries that are doing well are where the political leaders have really looked at this issue and sat down and spent sleepless nights to think of the solutions and to get out and make those who interact with the people and who provide the services do that kind of work. In the morning, Sabelo talked about the AIDS Watch Africa. If you find that there is any other topic that is discussed on this continent, year in, year out, every year in July, African Union puts together all the heads of states, and they decided that this is such an important issue. So the person who is heading the African Union, the chairperson of the African Union, say for example today President Conde, he is the chair of the AIDS Watch Africa. And they come together and they discuss these targets. I think it's very, very important that when they go back, the governments that they lead, the governments that you control, that you call in to ask questions of how progress is going, it's very, very important that they show this leadership so that you are able to get the information, but also to support them to move on this target. There is, alongside the political leadership, we need to put our money where our mouths are. And I think Sabelo mentioned Abuja. There were commitments in Abuja where 15% of the budget was to be committed to the health sector. Is it being committed? Are the financial budgets that are presented to the MPs to approve, do they contain a budget line on HIV, or is HIV relegated to the other projects that have a short life and so on? So these are some of the areas that I feel that the MPs can really be very, very instrumental in moving forward. Partnerships, I think I mentioned that before. It's important to understand who the partners are. MPs speak to ambassadors in their cities. MPs speak to donors in their cities. MPs speak to the private sector. I think it's important that we build partnership if we are to achieve the targets that we were shown earlier. Innovation. I think one of the innovative things that some countries have been doing is to make sure that even when you're talking about agriculture, you speak about HIV. If you're talking about IT, How can IT help move the pointer towards getting better? I think it's really, really key that we have innovative ideas. Earlier on in a conversation, we were told that testing has been so much democratized that you can also test yourself in your own house. So are we asking our governments if these testing kits are affordable enough or can be obtained for our countries to be able to test, for our people to be able to test themselves? Just like a woman can test if they are pregnant, HIV can also be self-tested. If not, what needs to be done? I think these are some of the things that we need to be doing. Good. Now, there is just a visual picture that even I shared last time with those who we discussed with, of where parliamentarians are, which we believe is really at the center. They deal with heads of states. In some government settings, parliaments call in their prime ministers, their heads of governments, to answer questions. Are we conversant with the targets that our countries are supposed to move on enough so that we can ask them, or we can ask them where to support them? Parliamentarians pass legislation. One of the big issues that is causing slowdown in some countries are laws or legislation-related matters. There is the stigma and discrimination sometimes that emanates from a country's laws. Are we looking at these? There are issues to do with access to drugs that are affected by the legislation on trade in some countries. Are we able to look at this so that it favors that quick pace that we want? Regional parliaments are sat in by national parliamentarians. How can we galvanize our efforts within those settings? HIV, like many infectious diseases, doesn't know any borders. In Africa, we have a lot of land transportation. We move across borders so easily. So one country doing well is not enough if their neighbors are not doing enough. And this is the importance of having regional parliaments. Ministries of health are answerable to parliamentarians. The parliamentarians, as I said, are people's leaders. They also deal with influential people like first ladies, like leading business people. All those people really are those that parliamentarians can innovatively try to bring together, try to reach out to, and try to work with to be able to move the AIDS response forward. Since we had meetings in the last two times, it would be interesting to know which MPs went back and worked with their parliaments or strengthened their health caucuses, strengthened their HIV caucuses, or at least intend to go and form HIV caucuses, cross-party caucuses, if those do not exist. I think those are really key, because once parliamentarians bring their voices together, if you come from countries like mine, I know that an MP, once they give you an invitation, you really have to do your reading and you have to prepare yourself. So these people can really inform MPs of what data is really current in their own countries. There are these milestones and targets, the continental ones, but at our country levels. I think this is where really the MPs can have a huge, huge impact. That next slide, I think I should just go over it because I mentioned it in many other sectors, about budgeting, about leadership and governance oversight, about really being global actors, about looking at what human rights challenges are, about advocacy platforms that are only and only available to MPs. It's only an MP that can act locally, that can act regionally, that can act continentally, and even globally. It's not every citizen that can do that. So we feel that with that kind of platform, I think we can go a long way to helping this continent to achieve ending AIDS by 2030. The way forward, those are some of the points we thought about. What are the 2-3 things that we should walk out of this hall with and know that the next time we meet, we have all been able to achieve? Who are available at our countries? And these differ from country to country. But it's important that each country identifies who the partners are. For us in UNAIDS, we have our co-sponsors, we have governments that are donating, and we have a private sector that is beginning to show interest. And of course, which tools do we need? I'm very sharply aware that at the last meeting, we mentioned how do we get tools, how do we get handbooks, how do we get that critical information that we need to be able to move. And I think here we can discuss and concretize how we can do it together. Thank you very much.
Merci beaucoup, Madame.
Thank you very much, Madame Rosemary, for your wonderful presentation. Now, we are going to go on to the next point. We are going now to move to panel number 1. The panelists are Dr. Badara, and Doctor from UNAIDS 1990. Now, there is one panelist member who is not here at the moment. Mr. Mangate. It's Ms. Mangate. Then Ms. Viviane Onano.
A panel discussion. The panelists have been invited onto the high table. I will be moderating the discussion. The chairperson will now assume a position of being a panelist, but we are short of one panelist member. May Mangate, I think you are part of this panel. I would like to invite you to come over as per our program. But while the panel is getting ready, while the panel is still getting ready, as a co-convener, I would like to do this. I would like us to do this quickly. Starting from starting from here, I would like us to do this quickly. I would like us to introduce ourselves with the panel. I would like the panel to know the wisdom that is in the house, the experience that is in the house, the organizations that are in the house. Of course, we know we're in the presence of the honorable members, but I think it would be important for us to introduce ourselves and state clearly, if you're a member of parliament, which committee are you representing? We would be very much interested. And the partners will also them to state clearly their roles and responsibilities in the organizations that they represent. I will appreciate if we can do this quickly and not make statements and not make speeches, just to introduce ourselves. That will be great. I'll start right here, and we will go like this, zigzag, until we get to the end, and we'll move this side. We just want to understand and appreciate the wisdom that we have in the house. Thank you.
Merci beaucoup, Monsieur le Président.
Thank you very much, Mr. Chair. Recently, the UNESCO Regional Office, and I am the Regional Officer, Health in Johannesburg.
Academic and a technical lead on evidence interaction for a research program on HIV prevention for vulnerable groups, adolescent girls, MSM, and prisoners.
Good morning. I'm David Allen. I'm with the Bill and Melinda Gates Foundation based in Johannesburg.
Je suis Sid Ahmed Mogoya.
I am Sudiga. I'm Moyameya. I am member of the PAP. I'm a professor. I work in the Health Committee.
My name is Caroline Chacho. I'm the Executive Officer for the Regional Director for UNAID Regional Office based in Johannesburg.
Je suis Madame.
I am Madame Toure Ayageni, MP at the National Assembly in Ivory Coast, Vice Chair of the Committee on Social Affairs and Cultural Affairs.
Everybody, I'm Dr. Maisela. I'm the member of the South African Parliament. I'm in the Health Portfolio Committee. Thank you.
Good morning, everybody. I am Dr. Susan Tembekwayo, a member of Parliament in South Africa. I'm representing a committee on health. Thank you.
Good morning. My name is Dr. Ruth Labode, a member of Parliament for the Parliament of Zimbabwe, the chairperson for the Health Committee on Health, and the SADC co-chair for the Global Caucus of Parliamentarians Against TB, and a champion for KP. I can go on.
Good morning, everyone. I'm Yunus Mohammed, the Program Manager for SAPEM, Southern African Program for Access to Medicines.
Morning, everyone. My name is Daniel Molokele. I work with civil society and health across Africa. I'm also representing civil society on access to medicine, working with SAPAM. Thank you.
My name is James Goni. I'm from South Sudan Parliament, member of Finance Committee there, and a member of PAP, and a vice chairperson of Committee on Monetary and Financial Affairs here in PAP.
My name is Ignatius Muswani, member of Finance and Estimates, Botswana Parliament. Thank you.
Good morning. My name is Reda Amer. I'm a regional specialist on HIV and AIDS for the International Labour Organization.
Bonjour tout le monde, je m'appelle Hassan.
Hello. I am Hesma from the Parliament in Djibouti. I am a member of the PAP. Thank you.
Regina Sparwan from Seychelles. I'm a member of the HIV/AIDS Committee at the National Parliament and also a member of the Health Commission in PAP. Thank you.
Good morning. My name is Pam Pillay. I'm from Elia, now Abbott, and so from the private sector. I'm the HIV Marketing Director for Rapid Diagnostics.
Good morning. My name is Bongani Mdluli, a member of Parliament from the Kingdom of Swaziland. I'm also a member of the Health Committee in the PAP. Thank you.
Good morning, everyone. Good morning, everyone. I'm Dr. Matseke Naga, a medical strategist representing private organization, Executive Director, Trans-African Medical Group, More Infrastructure Development. Thank you.
Good morning. I'm Mr. Raymond Token Kitio. I'm the staff member of AFCON, African Commission Nuclear on Energy. Thank you.
I'm Agnes Lasova, from MP from South Sudan, and a member also of PAP in the Committee of Gender and Social Welfare.
Good morning. Good morning, everyone. My name is Olibile Kosindwa, Secretary for the Finance and Health Committee, Botswana.
Good morning, everyone. Bashir Ndao, UNAIDS Regional Office.
Good morning. My name is Lonpile Mabuza. I'm from the Centers for Disease Control in Pretoria. I'm the TB/HIV lead.
Bonjour tout le monde. My name.
Good morning, everyone. I am Helen Eckermann, and I am with CIVOS, Southern Africa.
Adolescent and youth, and HIVOS also manages a regional project on key populations.
Good morning, everyone. My name is Sinjabulo Mabuza, the MP from Swaziland and the chairperson for health in the kingdom. Thank you.
Good morning. My name is Maud Kumalo. I am the chairperson of the Portfolio Committee on Finance in the Kingdom of Swaziland. I'm a member of Parliament. Thank you.
Bonjour tout le monde.
Good morning, everyone. I am Atsu Suno. I am MP from Niger, member of the PAP, and I work in the Committee of Education here at PAP.
Good morning, members of Parliament and colleagues. My name is Moses Mngwabe. I'm a researcher at Parliament of the Republic of South Africa.
Good morning, everybody. I'm Professor Jeffrey Longwangwa, Member of Parliament from Zambia, and a member of the Pan-African Parliament, and I'm in the Monitoring Finance Affairs Committee here. Thank you.
Good morning, everybody. I'm Celestine Kumire, Program Director for SAPAM, Southern Africa Program on Access to Medicines.
Good morning, honorable members. My name is Marie Bebe. I'm the committee clerk. Thank you.
Morning, everyone. I'm a member of Parliament from Botswana. I'm Billy. I'm a member of Health and HIV and AIDS in Botswana, and also a member of PAP under Health Committee. Thank you.
Good morning, honorable members. I'm Lisbeth Mangati from National Department of Health in South Africa. I'm coordinating AU and NEPAD activities. Thanks.
Good morning, honorable members. My name is Nonhlanhla Ncube-Ndaba. I'm a member of parliament in South Africa. Thank you very much.
Good morning. My name is Honorable Dr. Christopher Kalila. I am the chairperson of the Health Committee in the Zambian Parliament. Thank you.
Okay. Good morning, everybody. I'm Dr. Olusegun Dumosu. I work as the HIV and Health Systems Manager for African Men for Sexual Health and Rights. Thank you.
Good morning, ladies and gentlemen. My name is Janet Biarohanga. I'm with the NEPAD agency as a Senior Program Officer, Public Health.
Good morning. I'm Rhino Chipiko from Malawi Parliament. I chair the Committee of Budget and Finance. Thank you.
And I'm Juliana Lunguzi, Malawi Parliament. I chair the Parliamentary Committee on Health.
Good morning, honorable members of parliament and colleagues. I'm Rosemary Mseminali. I represent UNAIDS to the African Union and the ECA.
And good morning, I'm Catherine Sozi, the UNAIDS Director for Eastern and Southern Africa, based in Johannesburg.
Good morning, ladies and gentlemen. My name is Mahamu Khamuhali. I'm responsible for the Champions for an AIDS-Free Generation. Thank you.
Thank you very much. Thank you very much, honorable members, ladies and gentlemen. I think now we are comfortable and we are aware who is really in the House and how the House is composed in terms of the honorable members and the countries that are represented, as well as the experts that are represented in the House. We are now starting our panel discussion. So I will give 1 minute to the panelists to introduce themselves. To introduce themselves, I will do ladies first. And then we move to that direction. As soon as they've introduced themselves, then we'll also announce how our panel discussion will pan out. Thank you.
Good morning. Good morning. Good morning. My name is Vivian Onano. I'm a youth advisor to UN Women, and I'm a global youth ambassador for WaterAid, and I'm also the partnerships manager for SEED projects. I'm happy to be here.
Good morning. My name is Dr. Badara Samb. I am the special advisor to Michelle Sidibes, who is the executive director of UNAIDS. I'm based in Geneva, and I'm very, very happy to be here.
Bonjour.
Good morning. I am Aurelia Simply-Singas from Central African Republic. I am a former Prime Minister, and at the PAP I preside, I chair the Committee on Health and Work and Social Affairs.
Ladies and gentlemen, so those are your panelists for this session. Let us reiterate the title and the topic of this panel discussion. This panel discussion will focus on HIV and health targets in Africa, UNAIDS fast track, and the catalytic framework targets. You can see clearly that there is a focus on targets. In other words, a focus on where we are going. Where we are going to 2030. In line with the SDGs, in line with the Agenda 2063, in line with the catalytic framework, in line with the fast track of UNAIDS. That is where we are going. We are looking at the targets, but we just want to understand how are we going to meet these targets? What is it that we need on our journey to meet these targets? Are we ready for these targets? One of the highlighted objectives of this meeting, of this parliamentary meeting, is to provide space for dialogue and advocacy. And therefore, I would like to use this space for dialogue and advocacy in the context of parliamentary work, in the context of the institution of parliament. How can the institution of parliament mobilize its efforts to assist towards reaching the targets that are set for health in Africa? The other purpose is to amplify the call for increased national health financing for health and more efficient utilization and available resources for health. The other thing is to focus on discuss the health systems in order to achieve these commitments in the context of Abuja Declaration, sustainable development, the catalytic framework, Agenda 2063. This is the purpose for our meeting. This is why we are here. We want to provide a space for dialogue. So without further ado, I would like to invite Honorable, the chairperson of the Pan-African Parliament Health, Labor and Social Affairs Committee to open the floor by making introductory statements focusing on the work of the Pan-African Parliament as well as the work that the HIV and AIDS Portfolio Committee from his country is doing and what we can learn from that. Honorable, you have 4 minutes to make your introductory statements. I thank you.
Merci beaucoup.
Thank you very much. Maybe I will not use the 4 minutes that have been given unto me. Maybe 2 will be sufficient. I would like to thank all the partners of the Pan-African Parliament that have helped us to host this meeting. And for us at the committee level, this is not the first time. We have had meetings with other partners in the health sector, and we believe that this meeting will actually come to a conclusion that will allow all the African parliamentarians to bring new information into their countries, because the HIV issue, as we've heard this morning, is everywhere in Africa, and that is if we only want to talk about Africa. And the Pan-African Parliament, through its partners, should bring about model laws that could be passed in a number of countries. And of course, this meeting is most welcome. That we would want the level of the committee, though, for this to be broadened so that we include all the other African parliamentarians. This is the moment of when the parliaments are actually debating the issue of the budget, and I believe there are a number of questions that were asked to know if the HIV/AIDS, TB have really been taken into account as per the declaration of Abuja. And of course, we would wish for our partners like the WHO does regularly in other sectors that UNAIDS may help us to come up with a model law that we will present in our various parliaments. Maybe this is what I can say as an introduction. But of course, we will spend more time listening to you, the experts on this issue. Thank you.
Thank you very much, Honorable, for raising those pertinent issues on what maybe you expect from the partners and from all of us, or from AU. You highlighted the issue of development of the model law. So we'll hear, as we continue our discussion, the possibility and what is available currently in terms of the model laws. I would like to invite UNA's representative, Dr. Badara, to make his introductory statements. The minutes are between 2 and 4. You have the floor, sir.
Thank you, Sobelo, and thank you for the invitation, and we are very grateful to be able to be part of this very important panel. I will start by just disclosing a quick conversation that I had with Michel Sidibe yesterday when I was leaving Geneva to come here. And of course, as usual, every time I leave for a mission that he asked me to go, I ask him what should be our key messages. And one thing quite interestingly that he told me was, you know, Badara, you're going to a meeting which is the type of meeting that I very much like to attend. I like to go to meetings where I discuss with parliamentarians, because parliamentarians are those people who know the needs of the people, and most importantly, the need of the most vulnerable. So so I feel very, very privileged to be able to discuss, converse with eminent parliamentarians here. And before making my introductory remark, I just wanted also to thank very, very much our newly appointed regional director, one of our best staff, Catherine Sozi, who is here, and also as well as Bashir Ndao, who work with her on the issue of parliamentary issues. I just want to focus my introduction on 1 month, which is the month of July of this year. The month of July of this year has been quite eventful in a good sense for the AIDS response, but also for health in general. And I will focus on 3 events that happened in July that I want just to report and put here as food for conversation between us. One is the UNAIDS midterm report on 90-90-90. I will not describe 90-90-90 because everybody knows about 90-90-90. What we have done is that since we launched the initiative 3 years ago, and looking for the next 3 years that will end the initiative, we wanted to take some stock, see where we stand on 90-90-90. And what we have been seeing and what we have reported in July was quite interesting, because we have reported that we are making fantastic progress. We are today at 70, 77, 81. Who would have thought that after 3 years of implementation we'll be able to report such a good progress? And more importantly, there are some interesting stories happening in Africa. Botswana has already reached 90-90-90. The United States did not yet. France did not yet. A country like Sweden did. a country like Holland did. But there are many countries in the Western world that have not yet claimed to have achieved 1999. And Botswana did it. And we have many other countries on the pipeline as well. And I can name Zimbabwe, Malawi, Zambia, Rwanda, Lesotho. They are all on the way, getting there. So there is something that we can celebrate in our continent. But that should not blind us. There are certainly some challenges that we are facing. We can celebrate Botswana, but we have other countries, many in Western and Central Africa, that are far from reaching those targets. And we have certain populations that are not benefiting from this progress. The children are not benefiting from the progress that we are seeing. The key populations are not benefiting from the progress we are seeing. Are not benefiting from this progress. So that is something that we also need to address. But there is one common factor that we have been seeing on those countries that are making very good progress. These are the countries that have based mainly their response to community mobilization and community involvement, especially use of community health care workers to advance the AIDS agenda, but also the health agenda. So the first event in July was the launch of our 1990 report, with all the good news that I said. The second event was what has happened at the recently concluded AU Head of State Summit. They have seen progress, and they have seen the importance of community health care workers. So all the heads of state of Africa, they united to launch a new initiative that they call the 2 Million Community Health Care Worker Initiative, which aims at creating, training, and paying 2 million young community health care workers in Africa to push the AIDS agenda and the health agenda. This is quite important. It's important because what we are talking here is we are talking about job creation. And when we talk about job creation in Africa, we're talking of reducing vulnerability. When we talk about community health care workers, we are talking about integration of HIV into health systems in general. Because when a community health care worker is out there, he deals with HIV, but he deals with other health conditions. So it's a good vehicle to integrate HIV and other health issues, have HIV taking up other health issues that are lagging behind. But also it is a good platform for a strategic conversation with the European Union. That is very much pushing for employment in Africa to mitigate migration. They put resources, we have a plan. So how we can put those things together. That was the second event that happened in July. And there is a third event that happened in July that deserves some conversation and food for thought. It's the G20 and an EU commitment. The G20, after the AU summit, and with also the fantastic advocacy of President Condé, who is the current chair of the African Union, who attended the G20 came up with an initiative to create 1.2 million rural jobs in Africa. And the European Union committed to put 2.3 billion euros for job creation to mitigate migration. So these are quite good news. We have a platform, we have an opportunity for job creation to end certain. The AU, the G20, the EU at a very highest level committing to something. But this makes sense only if this trickles down into real implementation, into real conversation in parliaments. That's why this conversation for us is very important. This meeting for us is very important. I'm very, very pleased that in the panel here we have the chair of the Commission of Health, of Labor, and of Social Affairs. When we talk about community health care workers, it's about health, it's about labor, it's about social issues. So I'm very much looking forward to this conversation today. Thank you very much.
Thank you very much, Dr. Badara, for outlining those key and important issues in the area of health honorable members, ladies and gentlemen, I now invite Miss Vivian Onano to address us. When I was when I wanted to find out the background of where she comes from, she said, Onano means resilient and never give up. Isn't that wonderful? It is. You have the floor, ma'am.
Thank you, Mr. Moderator. Ladies and gentlemen, it's an honor to be today and be part of this important discussion as a young person, as an African, and also as a very passionate youth advocate. The focus today, I've been learning a lot from the past speakers, from the opening ceremony to the presentations that have been made, and just seeing the cohesiveness between the fast track to end AIDS, the Sustainable Development Goals that I was fortunate to be a part of, and the Africa Health Strategy by AU for the 2016 to 2030. We all know that health is a human right that must be accessible to all. And looking at AIDS target for 2030, 0 new infections, 0 discrimination, 0 AIDS-related deaths. And the most affected demographic is between the ages of 15 and 24 years. And this year, the AU theme is on harnessing the demographic dividend, harnessing the power of young people, harnessing the future of the continent, which is us young people. But if we're talking about 0 new infections, 0 discriminations, and 0 AIDS-related deaths, and yet we are the key population that is most affected. It's an honor to be here also with the parliamentarians, because I believe you have the power to make the difference. And you have the power to put in place laws and policies that can enable young people to have access to quality healthcare, but also be able to tackle some of the key barriers, social barriers, economic barriers, cultural barriers that we as young people face when it comes to access to healthcare. And also the stigma and discrimination on the ground. We talk about 0 stigma discrimination, but the reality is there's still a lot of stigma and discrimination on the ground. And it's still very hard for even a young person who is educated to come out and share their status, or even start taking the medication so as to continue a healthy life. And I think for the parliamentarians, you play a very huge role by coming out. And I remember a couple years ago on December 1st, one of our members of opposition party in Kenya came out and had an open HIV testing and shared his results, and everybody was running to get tested. And I think for the parliamentarians, because you are on the ground and you serve as role models and you have more contact with the people on the ground, it's important for you to be able to openly promote voluntary testing and share your results too, and just to help curb the whole stigma and discrimination. I think for young people it will be very important. And if you look at the targets for 2020, UNAIDS came with 10 ambitious targets. And if you look at target number 3 that talks on 90% of young people are empowered with the skills, knowledge, and capability to protect themselves from HIV. I think it's also important for us to ensure that the curriculum that's presented at school has the necessary information on HIV prevention and also sexual and reproductive health rights, because information is vital, information is key, and information is power. And unless young people are empowered with the right information, and it has to be in a cultural context that they can be able to understand, but also be able to share among themselves, that's when we can be able to talk about prevention. We know prevention is cost effective, but unless we have the right information and unless we have open spaces to have these conversations, we will not be able to reach our target on 0 discrimination and 0 new infection and 0 AIDS-related deaths. So thank you for that.
Yes, a round of applause. Thank you very much for these important and pertinent and very strategic messages that have been put across by our panelists. But we would like to open this opportunity, open the floor for you, honorable members, to really take this opportunity and discuss and also reflect on the statements that have been made here in the front. From the statements that have been made, do you think we can end AIDS as a health threat by 2030? From the statements that were made in the morning and now by the panelists, what do you think are the vexing challenges for AIDS response, for TB response, for malaria response, and for all other infectious diseases? What do you think are the vexing challenges? Why are we not moving forward in other areas? But of course, we appreciate the report that we got from UNAIDS that we are making progress. Towards 1990, we are already in the 70s. And there are certain countries that have made remarkable progress. So in terms of your perspective, honorable members, ladies and gentlemen, which part of response do you think we need to strengthen? Is it the biomedical approach? Are we making progress on the biomedical approach? Are we making progress on the behavioral approach? Are we making progress on social justice, the stream of work? Which part do we need to strengthen the most? The lady, Vivian here said, you members of parliament have the power to make a difference. So I open the floor. I will start with the member states. I see the hand. Well, I will mention if I know the country. I see the hand from Zambia. It's noted. I see a hand from the back. It's noted. I see a hand from Cote d'Ivoire. I need the fourth one. I see a hand from Zimbabwe. In that order, please, you have the floor, honorable members.
Thank you very much, moderator, Mr. Savelo. And like I said, my name is Honorable Dr. Kalila from Zambia. I'm the chairperson of the Health Committee, and I would like equally to express my sincere gratitude for the invitation extended to my committee to come and be part of these deliberations. I also applaud the high-level presentations that were made this morning. I also applaud the contributions of the panelists, which have been extremely very useful, particularly the information from Dr. Badara with regards to those 3 important milestones that took place in the month of July. I must admit that I'm only learning them for the first time, and I think it has been very insightful. My intervention in this regard is I would like to contribute on the question as to whether it is possible to eliminate or end this very important scourge of HIV/AIDS, which we've been dealing with over the last many years. Like the presenters have said, and I agree entirely, that yes, we are making progress, we are facing challenges, and that it can be done. However, I would like to throw a challenge that one of the difficulties I'm beginning to see is that our response, particularly on the African continent, continue to be financed mainly by donors or development partners, whatever name you can use it. And I see that even in our context as a country, we are grossly worried with the fact that it is important that we begin to take ownership of this response. I think even His Excellency Motlanthe members of parliament and member states to increase domestic financing to this fight. And I see that we have seen from the presentation from Madam, what's the name now, Mosimali, that we've increased at least 141% contribution member states, which is commendable. But I think that the bulk of the response continues to come. I mean, I heard PEPFAR being mentioned here, Global Fund. I am therefore wondering, Mr. Sevelo, why, as African Union, we can't ourselves also initiate a fund? Initiate a fund, I mean, on the lines of PEPFAR or Global Fund or whatever we can call it, an African Union fund for fight against HIV, TB, and malaria. And I'd like us to deliberate or talk around this, whether it can be done, why we are not doing it. I mean, we are sitting back hoping that our neighbor will continue to finance our health. I think that doesn't work that way. Secondly, the other challenge in the fight against this is obviously we know that now the catchword is leaving no one behind. But I'm extremely very worried with the issue of key populations. And I know that most of African countries still have draconian laws or discriminate against these key populations. So as African Union, I would like to know what we are doing to impress upon our governments, obviously, to reform some of these laws. I mean, we heard this morning why we can't, for example, begin to look at, to provide health to prisoners from a public health perspective and not necessarily look at them like people who deserve to be punished and die, and therefore behind those walls. I know it's a taboo to talk about condom programming in prisons, but certainly we can do something. I mean, we shouldn't leave somebody behind. These are areas where I think we will continue to incubate this problem, and it can therefore negate our responses. I thought I should just contribute on those two aspects, and I'll come back later. Thank you.
Thank you. Honorable.
Merci, Monsieur le Modérateur.
Thank you, Facilitator. Before I proceed, I would like to commend the different panelists. But coming back to your question, I am tempted to say that we should actually emphasize on sensitization, because HIV, AIDS is a disease that can be prevented through behavior. We know what can be done and what should be done in order to prevent it. So maybe we should look more into some awareness campaign and sensitization. And it is because of that that we've been able to make some strides, although we still have people that believe that HIV AIDS does not exist, particularly the men. Now, how can we bring them to the belief of the existence of the disease? And that is why I believe that we should have continuous sensitization around the disease, so that these people who believe that it does not exist, that we may able to bring them back to reality. Number two, when the person know that he or she is infected, will do everything they can to contaminate or infect other people before they die. They say, I will not go alone. I should infect as many people as I can. So I believe that we should focus on sensitization, because ARVs everywhere almost are being given freely. There's no issue on that. But we have to continue to really sensitize, to bring back people back to reality. Thank you. Thank you very much.
We had an order here. We had, yes, Cote d'Ivoire, and then Zimbabwe.
Merci beaucoup. Moi, je suis du Parlement.
Thank you very much. I am from Cote d'Ivoire. I was very pleased to hear all the panelists this morning. It is my first time to participate to a summit of this level, and I am quite pleased to hear that HIV/AIDS is decreasing. Indeed, we see that the infection rate is declining. As one of my colleagues said, the ARVs are free and sensitization is being done. Even women in my country, in Cote d'Ivoire, that are infected are able to give birth to babies that are not infected. But what we still see, and maybe I agree that the parliamentarians should here play a very important role, is with the rural population, because all this is happening in urban areas, but we have not really sensitized the people in the rural areas on how to prevent the infection. Of course, we know that many of them are illiterate, but they are not really responsible in the way that they think. Like my colleague said earlier, that HIV/AIDS does not exist, and then there is this cultural aspect. If I am young and then I'm infected, it means it's not a disease. It's something that has been, it's a spell that has been cast on me. So we need to really work on sensitization. I know that parliamentarians have the art to speak and know how to convince. So I do agree with a panelist that spoke before me, and I say yes, they can play that role to sensitize, communicate, because if we can do that, particularly in the rural areas, we will be able to get to our objective of 80-80-80, because it's difficult still in the rural areas. Thank you.
Thank you very much. I want to challenge the UNAIDS, Dr. Badara. I strongly believe parliamentarians could do more. But there is one component that a lot of partners, civil society and the funding partners like yourself or the technocrat forget about parliamentarians. They are not elected because they understand engineering issues, water issues, or health issues for that matter. They are elected because people lack their character and lack what they are doing with them. Now when they come to parliament to represent those people, they are met by all these issues, important issues, which they don't understand. And yet, they are supposed to go back to the community. They have feedback community constituency meetings. They will only talk about what they know. Trust me. You hear a certain community well-versed with agriculture simply because their member of parliament has special interest and has been capacitated. So my issue is, I really believe, and I've attended a lot of meetings with parliamentarians, lack of capacity. Lack of capacity to carry the issues forward. If you capacitate parliamentarians, you will get, I'll give you an example. When we came to Parliament, UNFPA, there was an issue, a strong issue of sex workers. They invested in taking 2 parliamentarians, 1 member of the Justice Commission, an assistant commissioner, and 2 sex workers to India. to Kanataka, Bangalore. Initially, you know, I was a bit confused why we have to go and the composition of the delegation. But when we got there, and what was more shocking for me was when this girl whom I had been traveling with from Zimbabwe, when we were introducing ourselves, says, you understand? That was shock therapy for me. I said, okay. So as we spent days in Karnataka and learned how the reason why we were taken to Karnataka is because our constitution and the Indian constitution say the same words where sex work is concerned. But they have found a way around the constitution together with parliamentarians to actually not arrest their sex workers or arrest and release without any penalty. When we came back, we met as that committee. We had a press conference, and we then agreed 3 people would go and meet the justice. He's now late. The judge himself, the judge president, we went to meet him. Actually, before we even went, he read in the press that there's something like that. Then he called me and somebody else says, I want to see you in my office. Then he said, you people have misinterpreted the law. The Constitution of Zimbabwe says, if you are found soliciting for sex, you will be arrested. But before you confirm that somebody is soliciting for sex, you must identify the person I was soliciting sex from. And the person must say, yes, I was soliciting sex, which means the 2 of us now are what? Should be arrested. That was the end of sex workers being arrested. And all these years, everybody had misinterpreted the constitution. And for us, it was really an eye-opener. And because the law says in my country, if you go somewhere, official visit, you must come back and present a report in parliament. What happens when you present a report? It must be debated. Now you begin to talk about sex work in parliament. You did not smuggle it, it came official. So what I'm trying to say, build capacity. Whichever way, let's be strategic and make sure that our parliamentarians understand the issues very, very well. And also civil society, where you feel parliamentarians are lagging, be proactive. Don't wait for me to come to you. Come to me and say, there is this problem. Parliament, not civil society. And that is a partnership we should work. And I feel UNAIDS is remaining behind on that issue. You are too high there, New York, political declaration. I was there. But we come home, you never followed to say, then what? Thank you.
Thank you very much. I would like to give the opportunity to Honorable Jibril to make interventions and then request the panel to respond. Oh, there's another hand. Okay, then we will take 2. Okay, I see a lot of hands. Let me just allow Honorable Jibril to make interventions. You have the floor, madam.
Merci, Monsieur le. Thank you, Mr. Facilitator, for giving me the floor. First of all, I would like to join my colleagues and thank the panelists and as well as the presenters who spoke this morning. And they give us an idea of the situation in Africa in the sector of HIV and AIDS. Mr. Facilitator, you said earlier, what can the MPs do in the area of legislation so that they can support the catalytic framework? I can say that they can play 2 essential roles in the fight against HIV and AIDS. First of all, they can do something with the community. The community acts with the parliamentarians. I believe that if the MPs invest their time with the community and try to have or engage in advocacy activities with the community, or even if they engage in awareness activities, especially with the women, that would help because women are extremely sensitive as elements of the population. In Djibouti, we have an association of people that live with HIV, and this association is not hidden. And as a woman, I can say that lately, about 2 weeks ago, we, the lady MPs of my country in Djibouti, the chair of one of the committees of the Pan-African Parliament is also present here. I must apologize. I can't hear what Madame is saying. Okay, we are back on. So in this association, we are trying to make aware the people about the activities of this association and so forth. These activities were appreciated because we represent the people and the people are seen through us. I believe that advocacy must be done by the MPs. They must lead in that area. Before talking about the responsibilities of the MPs in decision-making, I believe that there is another problem as well that we need to address, especially countries within Africa must own these strategies. We are always waiting for organizations to bring us money to undertake our projects. Why don't our own countries own these projects? Projects in the fight against HIV and AIDS, against tuberculosis. If this is not done, we will not reach or achieve our objectives, the objectives that we have set. If we do not do this kind of work in our country, if we do not have a political will in our country, we will not succeed. So that to ensure that our activities are sustainable, we need to make sure that we do this groundwork. Last point. Let me talk about the decision-making by the MPs. We are all aware that at the end of each year, there is the law of finance that is done, that is passed in all our countries. So what we need to do, we need to make a call to the government and ask and find out how many laws have been voted with regards to HIV and AIDS and other diseases. We need to find out what has been achieved, and we need to have the right to look into the budget and see whether there is a budget line for the activities of awareness or for medication. If we will not play our role, we will not achieve our objectives. Thank you.
Thank you very much. Maybe let's get a mix. I saw a hand earlier from Daniel. I saw a hand. Please take the floor. And then I saw a hand there. Let me, and then from Swaziland, in that order, please.
Thank you, Chair. Just a quick one. I think some of the points that I wanted to raise have been addressed already. Especially for me, the most important point is around ownership of the agenda, shown mostly by resources. How much are we allocating our own resources towards the health response, towards the HIV response? As long as you are still mortgaging it or borrowing other people to invest in health, and it's not going to work out. So we should put our money where our mouths are. And then I wanted to speak more around civil society as a partner, because parliamentarians are aware that civil society is a potential partner in terms of the watchdog role. But the biggest challenge that civil society in Africa has today is that its funding model traditionally has been from the Western countries. And since the global recession of 2008, most of the civil society in Africa who do advocacy work have been severely affected due to lack of funding. And most of them today who are still around are doing service delivery issues, which means they've devolved from being watchdogs to what we call lapdogs, entirely dependent on the governments to survive. This is an area of concern for me in terms of how can Parliament strengthen itself by affirming another watchdog like civil society in terms of the funding model. Is it possible for governments to fund civil society in Africa through Parliament? Because it is something that I'm worried about, that civil society is an essential component in the national agenda, in development agenda, but who is funding African civil society? And African parliamentarians should ask that question. Isn't it a responsibility of the African people themselves to fund civil society as a development partner? Thank you.
Yes. Yes, madam.
Honor and gratitude to you, Mr. Chair. Is it possible for me to refrain and get back on the next session, because this is very interesting for me as a medical strategist, a partner, a private organization, for me to contribute. I am more on the rural sensitization infrastructure, and the contribution that I once made here. And I was actually very intrigued by the honorable MPs from Cote d'Ivoire and Zimbabwe, who actually, spoke on lack of capacity to carry issues forward. Is it possible for me to come back next, and I'll deliberate more? Thank you.
Swaziland.
Thank you, Program Director. Program Director may be trying to answer your question about the approaches. Mine will be on the part of the behavioral support. I just want to believe that campaigns can play a pivotal role, more especially in schools and community centers. And also to develop the strategic, parliamentarians must have to develop their national parliament development strategies, strategic plans, so that they must be able to get a direction and help them to set the timelines on what needs to be done when and by when that must be done. Thank you so much, Program Director.
Thank you. I also see a hand at the back. You have the floor, madam.
Thank you very much, moderator. I think I want to try and respond to the question whether by 2030 we can be able to end HIV/AIDS. I think for now, I'm looking at our situation in South Africa. What I can say for now is that we can manage HIV/AIDS. And I think in South Africa we do have good programs. We are providing antiretrovirals treatment, but you see what we're lacking, it's monitoring on whether the people who are receiving these treatment, are they administering it as prescribed or not? But I think if we can implement the 1.2 million health workers to employ them and use them as people who can go and visit all these clients who are taking this treatment, they are the ones who can be able to give us feedback on whether these people are taking this treatment correctly as prescribed and not using it for anything else. Because the challenge that we are having now in South Africa is that some of the people who are taking antiretroviral treatment, they are using it for something different. There's a drug that they are making, it's called Nyawupe or something else, and which is a problem. And government is using so government is availing this treatment everywhere in South Africa. You can go to any clinic, they won't even ask you whether you are a South African or you are not a South African. You have access to the treatment. But the other challenge that we need to do is how then, as African countries control, especially with us in South Africa, there's high rate of influx of migrants moving from the neighboring countries coming to South Africa, and those people, some of them, when they come in the country, they don't declare their status. And I think what we should do is have health education and awareness, invest on health education and awareness every day, everywhere. Because if we can do that, even we will be able to draw in even the church. I'm sure the other question that we need to ask ourselves, what is the role of the church regarding this matter? Because I think the church can also play a vital role in assisting and ensuring that, you know, governments are able to educate our people in terms of the importance of them changing their lifestyles and so on and so on. So I think also, but we must have put this item as in part of our curriculum, you know, starting to educate our children from grade A. Because if we don't do that, you know, like now, I was sharing with my staff member here, Moses. He's saying to me he was in a taxi, and the taxi driver, if you want a woman, here, I can tell you places where you can get a woman. You can see that, you know, this person is not serious about life. How can he tell a person that he doesn't know, you know, a passenger, that you can go anywhere? You can see that, you know, there are people in real life that don't think it's important for them to change their lifestyle. So I think that was my contribution. Thank you very much.
Thank you very much, Honorable. Let me hold on. Well, I would like to hear maybe the impressions from our panelists, just briefly. Then I'll go back to the floor. Maybe starting from you, Dr. Badara, and coming, just your impressions about if you picked up some key important issues from the floor.
Thank you, Sabelo. You know, I'm just listening to the debate that's happening, listening to intervention by panel. I was just thinking that my executive director in our conversation was definitely right. These are the type of conversation we need. We need conversation with people who are very much close to people and raise issues that we do not necessarily think about. So I'm very, very pleased to be here. Let me just pick up on some issues that have arisen during our conversation, starting from the introduction from Sabelo himself, who was basically asking whether we can end AIDS. I think the answer is unequivocally a big yes. We can end AIDS. Look just what's happening at the moment. Today, in many countries, especially in the Western countries, pediatric AIDS does no longer exist. AIDS in children, nobody is hearing about it. So it's ended. When we look at mother-to-child transmission of HIV, in many countries, it does not exist anymore. You go to Latin America and the Caribbean today, one country after one country is being certified by WHO and UNAIDS as countries where mother-to-child transmission of HIV is no longer existent. You go to Botswana, which I just mentioned, 1990 is target is already achieved 3 years before the target date. So what all these examples show is that we know how to do it. now what we need is to move from example to something that's more universal, something that's more global. And on leadership, it will depend on financial and political commitment, and it will depend on how we can leverage the technologies that we know today exist and can allow us to end epidemic. I liked very, very much the conversation and that we had with the Zambian Member of Parliament. Basically, Zambia talked about domestic funding. I mean, I think it's time for us to move from domestic funding to domestic investment. I think if we put resources on AIDS, it's about investment. For every single dollars that we invest on the AIDS response, the return on investment is $15. So that is quite a thing. And there are many countries that have understood that. South Africa is one. Today, the vast majority of the South African response come from domestic resources. You can tell me that South Africa is rich as compared to Mali. So, of course, we need to tailor things. But let me just tell you that globally today, in the AIDS response, if you look at the resources that are available, 57% is domestic funding. It used to be up to 90%. So the countries are more and more investing in the AIDS response, and we need to continue that. Does this mean that we need to ask the international donors to start backing off? Certainly no. I think we need to make sure that we have a global solidarity here. And today what we are seeing, the trend that we are seeing is not good. We are seeing now international funding for AIDS response coming down. That Parliamentary and others, civil society, should get up and say it's a no for that. J'ai été très heureux de vous entendre parler de la nécessité de sensibiliser les populations rurales,
It is important for us to sensitize the rural population, not only the urban population. I believe that you are quite right. Your intervention responds properly to the intervention of the heads of states. Now, we need to involve the leaders of rural communities so that they can get involved with the communities. Doctors and pharmacists, they want to stay in the cities. They don't want to go to the communities. So we need to recruit community workers from their own communities, train them and let them work in their community. I would also like to seize this opportunity to congratulate the leadership of Ivory Coast that in December they will have a meeting in their country. So this will be a very good opportunity for Ivory Coast to sensitize the people from the whole world, as well as in Ivory Coast, on what is going on in the whole world in this sector. Djibouti spoke about the role of MPs. All I can say is to agree. And when we talk about the civil society, sickly.
Region where we have had good progress is those countries that have leveraged civil society organizations. So we definitely need to talk to civil society organizations. I totally accept the criticism that have been made. I accept totally the criticism that have been made by the floor on UNAIDS not having been proactive enough. It's never enough with parliamentarians. I think we need to work more and more with parliamentarians. And the example that you have been putting on the table are touching and illustrate the need for us to work with the parliament. Let me just tell you why we are here. We are here by design. We are not here randomly. We are here to discuss with Parliament. We are here to have plenary conversation, but also to have side meeting. We are planning to have a conversation with the chair of the Health, Labor, and Social Affairs Commission of the Pan-African Parliament to discuss how we can work more together, to touch more people. What can be our roadmap working together? So what you are saying come at a very, very right time. And it's exactly because of what you are saying that we are here. I just wanted to reassure you on that one. So thank you very much.
Thank you very much. Vivian, did you pick up any issues on which you want to respond?
I think a lot has been said by my fellow panelists, but I would definitely like to echo the honorable from Zimbabwe that talked about capacitating the parliamentarians so that they can be able to do more. As I said, they are the eyes of the people, and they are more reliable and they are more trusted by the people on the ground. And for them to be able to address the needs when it comes to health and when it comes to addressing HIV and AIDS related issues, they have to have the resources, and it's not only financial but also the human capital and resource for them to carry out the work that they need to do on the ground. So we can't just say parliamentarians have the power, but do they have the resources? Do they have the human resource for them to be able to do the work on the ground? I think that's really important and something that really needs to be looked into by the government, but also institutions such as UNAIDS that's working with them.
Thank you very much for that insightful observations. I saw a hand there, Honorable. Yes, that hand has been there, and then after that hand, we will go to Botswana. We are winding up, and I see a hand from South Africa again. So in that, and at the back, from where? From Zambia, yes. So in that order, please.
I thank UNAIDS and the panelists and all those who participated in this debate. Two things came up, that HIV and AIDS, it's not finished. This will continue. Without being pessimistic, I will highlight that the fight will be diminished because we have some good initiatives. First of all, if there's been some progress in Eastern Africa, South Africa, in Botswana, I must say that many countries are still not understanding the seriousness of this situation. And in my country and some other countries, we are not reflecting the truth, the reality on the ground. And one of our colleagues mentioned that the rural areas show no interest. There's the figures that we have come from hospital statistics, and what is happening in the rural areas we know nothing about. Secondly, there are some breaks. We cannot move forward unless our mindset changes. And of course, we also need to understand the behavior of society towards AIDS. And there is a lot of stigmatization associated with AIDS. Even parents do not want to talk to their children about this. AIDS, we understand it's punishment from God, it's someone else's fault. Of course, the MPs must be in the forefront, and there are also the faith-based institutions that are all involved in this fight.
The second point is that, first of all, AIDS is not just a fight through medication. It's you have poverty, ignorance. We really need good governance to be able to achieve our objectives. In my country, there's been mismanagement of funds, actually embezzlement of funds that was allocated to HIV/AIDS. So this is to say that there are many factors involved here. The second point is that this is an issue that concerns Africa, and when we talk about Africa, we are actually talking about the future of our children, of our young people. And I believe that there should be an important place here for research and information on progress of research for a vaccine against HIV/AIDS. Thank you, Honorable.
South African, right?
It's me.
No, Botswana. Yes.
It's me.
Thank you. He pointed at me, sorry. Yeah, I was trying to jot things down as I was listening to the panelists and to the contributors, just to get to see what it is that need to be done, what it is that we are missing. And I think maybe I want to settle on the behavioral approach of things. Life is mediated by a lot of interrelated phenomena that actually determine how you are going to behave. And that is, we need to understand that we need to craft our children in our own image so that they could do what our bidding. I'm impressed by Vivian there. It means that she was crafted in the image of those who socialized her, for her to reach that stage and sit in front of us here as a young girl and tell us what, and express herself without fear. That is socialization. And socialization takes different directions depending on who is socializing you for what reason. Okay, what would a nation be first instill in the children? If we instill values in children, and because children can learn what we teach them provided we know how to teach them, and they also learn by watching the behavior of their elders. If we ourselves behave in an honorable manner, our children will imitate us and behave in an honorable manner. And the first thing that we need to teach them also is hygiene. We must teach them health-related behavior so that they avoid infections and even non-communicable diseases. Because we can't do the same thing over and over again and expect different outcomes. And prevention is better than cure. So we spend a lot of money on trying to cure what we could have prevented by simply not doing it or avoiding it through socialization. So, and the other thing which is very important, the children must know that there is what we call resource capturing. Africa is bleeding resources, and they don't benefit out of the legacy that they have, which is plenty resources. We are poor, but we have the greatest amount of resources in the world than any other continent. Why are we? It's because we don't have the know-how. And those who have but do not know how will always be victims of those who do not have but know how. So we must try to get the know-how so that we can equalize the playing field. And even in our trade, it must be equitable. We mustn't just give away what we have and be happy to get something for it. And unless we do that, we can all sit here and talk about money and about aid and about this and that, to do this and that. If we don't do it ourselves and in our own way and let others help us, not let others do it for us, then we are on the way of trying to prevent this. Anything is preventable, anything is curable. I think sooner or later we will announce a vaccine that seems to be showing some hope that it can be done. But that's not what we need to do. What we need to do is to avoid getting infected. And it is the children who are the future, who must be protected at all costs by socializing them to understand these things and do the correct.
Botswana, thank you, South Africa. Botswana, please.
Thank you, Mr. Program Director.
Monsieur le modérateur, j'ai pas terminé.
My concern, or my answer to the question put on the floor is that yes, we can eradicate AIDS by 2013. But the biggest challenge that we are facing now in all African countries is that we are not involving the religious groups as much as we can. They are the most feared group today. Why I'm saying that is that one man can preach to 10 million people and say HIV/AIDS can be healed within a moment by a word of God. And this is posing a lot of danger in a lot of African countries, because a lot of people are watching TV, and the pastor, members of parliament cannot speak against the pastor, because if you speak against the pastor, you lose elections. So it's one area that we need to attend, to come up with something that can prevent a pastor to declare that you are healed before anything can be confirmed. Because that is one area where we are having a big problem. He can say whatever he wants to say, but he doesn't have to be declaring that you are healed. Your HIV/AIDS is finished now as I'm touching you. Because otherwise people will believe everything that the pastor says. So my suggestion is that we have to involve the pastors, traditional leaders as much as we can, to take them on board so that they can understand. Because also on issues of culture, we are having a problem. One area that we need to attend is to empower the girl child and women economically. Because the African culture is that when the girl is born, he's waiting for a man to marry. And we go back to the issue of the church, whereby they can declare to you that there is a miracle marriage, and then there is no need for you to check HIV/AIDS because God had said this is your man. And those things are really increasing the number of infections. So the reason I'm raising this issue is that we are trying what we can to educate our people, but the church is going backwards because they preach the power of God. And with HIV and AIDS, we can never allow such to be happening, to tell people that in a moment of that second you are healed, and the whole world, other people will just believe that it was true that the pastor is healed. And people will stand up in front of millions and say, I'm healed, without having to check to confirm. So now I'm proposing that we should come up with a law that prevents the religious people to declare that you are healed until they have got the second opinion from a medical doctor or something. Otherwise, that's my contribution for now. And thank you, Mr. Program.
Thank you, Botswana. I saw there was a hand from Zambia at the back. Yes, and thank you, Zambia.
Thank you very much, Chair. Listening to Vivian, I think Vivian has really hit the head on the nail. Hit the issue right on the head. Namely, what are we doing on the continent to package right information, right knowledge, and right skills, which are culturally relevant to the young ones between the ages of 15 to 24 years. And I think that's where the issue lies. And this is in line, with Africa's aspiration of harnessing demographic dividend of the young ones. Clearly, we are increasingly becoming a permissive continent. If you look all over the African continent, we have the challenge
of pornography, for example. Pornography, X-rated movies, and so on. And these are the things which are destroying the moral fiber of the African continent. These are the things which are really at the core of the way the young ones are being socialized informally. And we have to address that head on, even through legislation. Can we learn from each other? For example, those countries that have banned pornographic videos, where children go to learn these things, being socialized in sex parties, all these things. If we don't seriously address the moral decay of the African continent, of our societies, the young ones, the youth, are in danger. And I think what Vivian has told us is one very strong way to go, bombarding our school children, our college youth and the university students with the right type of information, the right type of knowledge, the right type of skills to prevent the infections of HIV. We have to do that. We have to engage in that kind of campaign very seriously to reach both the urban and those children in the remote parts of our continent. And if we can do that earnestly, sustainably, and seriously, it is possible to prevent the infection of HIV by 2030. It can be done. But we need, bold, I think, position to take along the lines of what Vivian has told us. Thank you, Chair.
Thank you, Honorable. We are wrapping up, but I just want to take a hand there. And Mauritania was sabotaged by technology. Let me come back to you. Let me take a hand and then come back to you, Honorable.
Thank you. I'm really inspired by all of the insightful comments that have been made. And so I've been noting them and just wanted to add a few things. I totally agree with the issue of pornography. And I was just at a meeting on sexual violence in Rio where that was the big issue that everyone, not just in Africa, everyone is concerned about it. And it has a connection to the topic of gender-based violence that I didn't hear much talked about, that 1/3 of girls first experience is often coerced. And so I think we have to look at that as well as the broader issue of gender equality, and then just generally the issue of social media as a source of information about things like pornography, but also about wanting particular goods. And that has a link to another topic I haven't heard about, which is transactional sex. The blesser culture is a big driver of HIV/AIDS with adolescent girls who in some instances are choosing to forego the use of condoms to be able to get things. So these are all difficult issues around intergenerational and the comfort about talking about sex. So we have the ISA agreement on comprehensive sexuality education, but what we're finding is that teachers and parents do not feel comfortable talking about that. So how we sort of open up that discussion, I think, is also very important. And then just generally, I think there's been progress on adolescent and youth-friendly services, but overall I think there are challenges that adolescents face in accessing services because of judgmental behavior on the part of adult healthcare workers and just access to the services because of school hours, etc. Thank you.
Thank you very much. And then let's go to Mauritania. Mauritania, we apologize for sabotage by the technology.
Merci de me. Thank you for giving me the floor. I wanted to come back on an issue that was mentioned by one of the colleagues, is we should It's true, respect the secrecy of an individual or doctors, but if the individual becomes a menace to society and continues to infect the people around him, we should look at having laws in that direction. There are examples in my country, even my colleague from Côte d'Ivoire know a bit the situation with Mauritanians traders that come back home with a lot of money and do marry 2 to 3 wives, and sometimes these people are already infected, and these are women that are also going to be infected. So maybe we should look at criminalizing these types of infection, and why not also be able to insist on premarital screening or testing to ensure that people who are getting ready to get married may know their status. Thank you very much.
But let me take a hand there at the back, and then I'm going to ask the panelists in 30 seconds to wrap up, and then we'll break for lunch.
Thank you.
Yes, madam.
Just to introduce myself again, I'm Pam from Alea Healthcare, now part of Abbott Diagnostics, and so from the private sector. It was very interesting. Dr. Sam, you had mentioned about every dollar spent has a $15 return, and really giving due consideration for the investments that are taken, and especially as parliamentarians, the decisions that the influence that you have. And something that I think is also important, just from a diagnostics perspective, as we think about the fight against HIV, and you mentioned as well about the gap that is currently being shortened in the 90 goals, but I think particularly the first 90 being just so important because the knock-on effect is that the second and the third 90 are so affected when the first 90 is not successfully attained. And thinking about that money that is spent, using the right tools for diagnosis is so critical. And we have really seen great progress on that, specifically in Africa, using good high quality diagnostic tools in the field. But something that we have not seen great success on is adoption of new technologies in that first 90. And I just want to raise it as a thought process for now, and possibly discussion in the future. Currently there's a 4th generation HIV screening tool, which only 3 countries in Africa have actually adopted so far. I know it is an Alea product, so it's fine. But I just want to raise that as a consideration, that there are processes that take place in governments, technical working groups, to actually adopt these sort of technologies. There is data that shows good performance, and yet the adoption is slow. For a couple of cents more on what you may be paying right now, or governments are paying right now, the adoption is still not taking place. And it's not so. And with 4th generation testing, you're getting a more sensitive technology which can actually pick up more HIV in patients. And thinking about the fact that we are focused heavily on key populations, adolescent youth, who are highly infectious when they get infected, using the right tool that can actually pick HIV up in those patients when they're in that window period is extremely valuable and extremely thought-provoking. So I think that, just thinking about, what we're doing to actually reach and shorten that gap is also about using the correct tools at the right times, and how you can do that in those very vulnerable populations and key populations is a process to perhaps think about.
We thank you very much. So I think we've got just some pending issues, people who want to make the interventions. the hand at the back, and then I come down to South Africa here, and there's a hand that I've been seeing here, just behind you, Bashir. Yes, the Honorable will pick that hand, and then we request the panel to reflect. Yes.
I'm Honorable Billy from Botswana. I wanted to share with you few issues concerning Botswana case on issues of HIV and AIDS. Ministry of Health, they have introduced what you call wellness. The emphasis there is on the health treatment and the wellness again. We also concentrate on the prevention than the cure. The other factor is that we engage other stakeholders seriously. Like a family, we believe a family, it's important to fight HIV and AIDS. So we engage families, community leaders, traditional leaders, because